All right, welcome. Today we're diving into a topic that, affects millions and millions of people all over the world, diabetes. We're going to break down what it is, exactly how doctors diagnose it, and the different shapes it can take. And we're basing all of this on the super comprehensive standards of care from the American Diabetes Association.
So here's our game plan. We'll kick things off with the basics, what diabetes even is. Then we'll get into the detective work of how it's actually diagnosed. From there, we'll explore the whole spectrum of types, not just the ones you hear about all the time. And finally, we'll wrap up by talking about why getting that label right is so important. Okay, let's start at the very beginning. Section 1. What is diabetes? It's a word we all know, but what does it actually mean in a clinical sense? Let's get a really solid foundation here.
So at its heart, diabetes isn't just one single thing. It's actually a group of metabolic disorders. The one thing they all have in common is a big problem with how the body handles glucose, which is its main fuel source. Basically, the body isn't using the sugar it has, but at the same time, it's making too much more. And all of that leads to the classic sign of diabetes, high blood sugar, or what doctors call hyperglycemia. Now, to really put this in perspective, you have to understand this one massive statistic. Even though there are a bunch of different types of diabetes, one of them just dominates the field. A staggering 90 to 95% of all cases are type 2. This one number really frames the entire public conversation about diabetes, and you'll see why telling it apart from the others is such a big deal.
Okay, so if the big problem is high blood sugar, how do doctors figure out if that's what's going on? Well, that brings us right to our next section, the path to diagnosis. Let's look at the specific, standardized tests that give them a clear answer.
Doctors have basically four main tools in their toolbox for diagnosing diabetes. The first one is called A1C. Think of this as the long-term view. It measures your average blood sugar over about 3 months. The other three are all glucose tests, and they're more like a snapshot in time. There's one you do after fasting, another after chugging a sugary drink, and a random one they can do if you're already showing clear symptoms. Hitting that specific number on any of these tests is a major red flag.
But here's a really important catch. One high test result usually isn't enough to make the call. Unless someone is in a full-blown hyperglycemic crisis, doctors need to confirm it. That means getting a second abnormal result, either by repeating the same test on a different day or by getting high numbers on 2 different tests. It's a 2-step process to make sure the diagnosis is rock solid.
So this leads to a pretty logical question, right? If you've got all these different tests, how do you choose which one to use? Is there a best one? The answer really depends on the situation and what exactly you're trying to figure out.
Yeah, the choice of tests really comes down to this. Are you looking for a snapshot or the bigger picture? A plasma glucose test gives you that snapshot, your blood sugar at that very moment. It's cheap and easy to do, but it can be thrown off by what you just ate or if you're feeling stressed. The A1C test, on the other hand, gives you that 3-month average. It's much more stable, you don't have to fast, but it is more expensive. So each one has its pros and cons.
Okay, so we know how it's diagnosed. Now let's get into the different flavors of diabetes, starting with the 2 big ones you've definitely heard of. This is Section 3, a spectrum of types, where we're going to really dig into the difference between type 1 and type 2.
At the end of the day, the fundamental difference between type 1 and type 2 is all about insulin. With type 1, the body's own immune system attacks and destroys the cells that make insulin. This leads to an absolute deficiency. There's just none left. Now, with type 2, which is that 90 to 95% of cases, it's a 2-part problem. First, the body doesn't use insulin well, which is called insulin resistance. And then, over time, the body just can't make enough to keep up. So it's a relative deficiency, not a total lack of insulin. Now check this out, because this is wild. And honestly, a little scary. You'd think telling these 2 apart would be simple, but it turns out misdiagnosis is way more common than you'd think, especially in adults. We have this idea that type 1 is something only kids get, but that's just not right. Get this, up to 40%, almost half, of adults who are eventually diagnosed with type 1 are first told they have type 2. It just shows how blurry the lines can be when it all starts.
But hey, the story doesn't stop with type 1 and 2. Not even close. In our next section, we're going beyond those 2 to look at some of the other specific and really important forms of diabetes out there.
So first up, we've got gestational diabetes, or GDM. This one is unique because it's diagnosed specifically during pregnancy, usually in the 2nd or 3rd trimester, and in someone who didn't have diabetes before they were pregnant.
Then there's something called pancreatic diabetes, which some people call type 3C. Now, this isn't an autoimmune issue, and it's not really about insulin resistance either.
Instead, it happens when the pancreas itself gets damaged, maybe from pancreatitis, an injury, or surgery. That physical damage just messes up the organ's ability to produce insulin.
And then you have these monogenic diabetes syndromes. These are pretty rare, and they're caused by a mutation in a single gene. A common example is MADI, which stands for maturity onset diabetes of the young. The tricky part here is that because they're genetic, they often get misdiagnosed as either type 1 or type 2, which can lead to people getting the wrong kind of treatment for years. So, we've defined what diabetes is, walked through the diagnosis, and explored this whole wide spectrum of different types. Which brings us to our final and maybe the most crucial section: why does any of this matter? Why is getting the classification right so important?
You know, I think this quote from the ADA really just nails it. Classification is important for determining personalized therapy. It's that simple. This isn't just about putting a name on a condition. It's about understanding the root cause so you can pick the absolute best treatment for that specific person. And this is really where the rubber meets the road. Getting that diagnosis exactly right has huge, real-world consequences. It tells you what treatment to use, like does this person need insulin right now or something else? It helps you predict how the disease might unfold. It can trigger screening for other related conditions. And for monogenic diabetes, it means you can do genetic counseling for family members. And importantly, it opens the door to the right clinical trials and the newest therapies.
So when you pull it all together, you see that diabetes isn't one thing, it's a whole spectrum. And figuring out where someone falls on that spectrum isn't just an academic exercise. It's the first and most critical step toward getting them the right care. Which leaves us with a really interesting final question to think about. As we learn more and more about genetics, are we going to move past these broad categories like type 1 and type 2? Could we be heading toward a future where a diabetes diagnosis is as unique and personalized as the individual themselves? It's a fascinating thought. Thanks so much for joining me.